Today, my lecture topic is about Chalazion. So, what is Chalazion? The definition of the Chalazion is the chronic sterile inflammatory lipogranuloma of the Memon gland. What do you mean by Memon glands? The Memon glands are present in the eyelids, which form the oily secretion for the tear films, and these Memon glands are present in the dorsal plates. Dorsal plates are present within the eyelids. The eyelids having the different layers from the skin, from the connective tissue, and from the dorsal plates. These are the layers of the eyelid which form the outer layer is a skin and the inward layer is a conjunctiva, and between these layers there is a dorsal plate and there is a subcutaneous connective tissue. So within the dorsal plate there are the Memon gland which form the oily secretion for the tear film. So whenever there is a chronic sterile inflammatory lipogranuloma occur, so it means that this is known as a Chalazion. So this hole is a Chalazion, and as you can see that within the eyelid there is a formation of the Chalazion occur. So this is a normal eyelid, lower eyelid is normal, and the upper eyelid having the painless swelling which is known as a Chalazion, and this is a chronic inflammatory lipogranuloma of the eyelid. Now, so this is a normal eye and this is a Chalazion in the upper eyelid. So what happened? There is a Memon gland and there is an obstruction. What is the pathogenesis of the Chalazion? The pathogenesis of the Chalazion is that it is caused by obstruction of the orifice of the Memon gland, which resulted in accumulation of the sebaceous secretion of the Memon gland. So what happened? Whenever there is a blockage of the orifice of the Memon gland occur, so whenever there is an orifice blocked, so it means that there is an accumulation of the secretion within the acina of the gland occur. So there is a pathogenesis. I will tell you about the precipitating factor, but first of all I will tell you about the Memon gland pathogenesis. What happened? Obstruction of the orifice of the Memon gland, there is a retention of the lipid secretion with induced chronic inflammatory reaction around it. So large number of epithelioid cells, as you know that in the chronic inflammation there are the epithelioid cells, there is the giant cell, there are the neutrophil, there are the plasma cell, there are the neutrophils, there are the lymphocyte present within the granuloma. So all of this is formed the granuloma, and this swelling will be appear in the eyelid, and this swelling will be a painless swelling because it is a chronic inflammatory reaction. It is not an infection. There is no any bacteria or no any other pathogen is present, but it is only the chronic inflammatory reaction which is a non-infectious inflammation of the upper eyelid Memon gland. So the precipitating factors are the blepharitis. The patient who is having the squamous blepharitis or other forms of blepharitis will be having the Chalazion, recurrent Chalazions, and the person who is having the diabetes mellitus, because in the diabetes mellitus there is a chance of the chronic inflammation occur. After that, the skin disease which is known as a seborrhea, which is a dermatitis of the which is one type of a disease of the skin. So in this type of skin disease there is also formation of the Chalazion occur, which is a recurrent Chalazion. So this whole is the obstruction of the Memon gland orifice lead to the formation of the Chalazion. So as you know that the Chalazion is a painless swelling. There is a clinical feature. It occurs more common in the upper eyelid. Why it is more common in upper eyelid? Because the amount of Memon gland is more in the upper eyelid than in the lower eyelid. There are 30 to 40 Memon gland are present in the upper eyelid, and only 20 to 25 Memon gland which are present in the lower eyelid. So increased incidence of the Memon gland obstruction will be on the upper eyelid. After that, there is a characteristic. What is the characteristic of the Chalazion? So it is a painless swelling which is slowly increasing, and the patient feel that there is a normal swelling within the eyelid and gradually it is increasing. So he complained to the doctor that this swelling is increasing gradually. So after that, when we palpate the Chalazion, so there is we feel that there is a nodule which is present in the swelling. After that, when we evert the eyelid, when we do the eversion of the eyelid, so there is a purple or red flesh-like material which is present on the underside of the conjunctiva. So it is the signs of that it is a chronic inflammatory reaction, and there is no signs of acute inflammation are present. After that, the patient also feel blurred vision. Why the patient also feel blurred vision? Only in the upper eyelid Chalazion, because at the 12th o'clock position when the Chalazion is present, so it press the cornea, because when it press the cornea, so there is a astigmatism, and when there is a astigmatism, the patient feel blurred vision. After that, what are the fate of the Chalazion? What happened to the Chalazion afterward? So there is a spontaneous resolution, means that we do only if we do not do anything, or we do only warm compression, so it will be resolved spontaneously. It will resolve by itself. After that, if it is not dissolved, so it become liquefy and form a Chalazion cyst or sebaceous cyst. So there is a fibrous sac appear, in which there is a fluid like material is present, and it is known as a Chalazion cyst. After that, if it is become fibrous, so it become a hard nodule, very hard nodule it become. So it is a complication of the Chalazion. After that, whenever there is a calcium deposition occur within the Chalazion, so it become a very hard nodule also. And if it get infected, whenever there is an Staphylococcus aureus will invaded into the Chalazion, so it result into the formation of the hordeolum internum, which we talk about afterward inshallah in other lecture. So what is the complication? The complication of the Chalazion is one is the astigmatism because of the pressure over the cornea, and the other complication is a ptosis. Why there is a ptosis occur? Because whenever there is a Chalazion is in the upper eyelid, so due to the mechanical pressure on the upper eyelid, so the upper eyelid will shut down, so it result into the formation of the ptosis, and it is a false ptosis. It is not true a ptosis because it is due to the Chalazion. After that, what is the treatment of the Chalazion? So there are the three types of treatment we can do. One is the conservative treatment, the other is a medical treatment, and the third is a surgical treatment. So the first treatment is the conservative, which is known as the expression or compression. What do you mean by compression? So when we give advice to the patient to compress. If the Chalazion is very small, so we give the patient advice that you have to take the warm compression for 10 minutes 4 to 5 times a day, so it will resolve spontaneously. Because when we do the warm compression, so this fat will be melt out, and when it melt out, so it result into the spontaneous resolution of the Chalazion. After that, we give the antibiotic and steroid, so the inflammation will be slow down, but it is not a full treatment of the Chalazion. And after that, we give the anti-inflammatory drops like NSAIDs drops for the decrease of the inflammation. After that, the medical treatment is a corticosteroid injection. It is used in the marginal Chalazion. Whenever there is a marginal Chalazion is present, which is a Chalazion of the duct of the Memon gland, so we give the corticosteroid injection. Or whenever the Chalazion is present near the punctum, so when we do the incision of the eyelid, so what happen, there is a complication occur and the punctum will be damaged. So to avoid the damage of the punctum, we give the intra-lesion corticosteroid injection, which will resolve the Chalazion. But if it is not resolve the Chalazion, so we have to do the surgical treatment, and the corticosteroid injection is a triamcinolone acetinoid into the lesion through conjunctiva. After that, the surgical treatment is the incision and the curettage. Incision and the curettage means, so we have to incise the Chalazion vertically. We will not do the Chalazion incision horizontally, because when we do the horizontal incision, so there will be chance of damage of the more than many ducts, because these ducts are arranged in the horizontal pattern, and when we cut the conjunctiva in a horizontal pattern, so there is a chance of damaging more ducts. But when we give the vertical incision, so there is a chance of damaging less ducts than the vertical incision. So we give the vertical incision, and there is a curettage instrument through which we curate all of the mebomin secretion which is present within the Chalazion. So after that, the Chalazion will resolve, and we give patient the antibiotics and the steroid for 4 to 5 days post operatively. So this whole is a lecture about the Chalazion. Thank you very much.